All right, post-run melt session. So grab your roller. If you have a band or a strap, you might want to grab that because we're going to do a little bit of lengthening. And today wasn't such a good run for me. It was supposed to be a long, slow run, and it was very long. I mean, it was very slow, and I cut the distance a little bit. But, you know, that's okay. I still did it, right? It's just, you just got to sometimes just get out there and humble yourself and just do it. So let's get set up here. Okay, so first thing we're gonna always do is do an assessment. So we're gonna have you lay back. We're gonna check to see stress, where we have it living in our body after a run or after a workout of any kind. And we're just gonna check and see, you know, if the weight of our head is sitting center behind our nose. Are we holding a lot of stress, which I am for my panting breathing from running, in our upper shoulders? Ideally, it should be right heavy in the lower ribs, around your sports bra line. I've kind of got a big curve going right now, tensional pull of my shuffle running and heels, so we're going to be working on that. Ideally, your low back curve should just be from the belly button down, and then just take an awareness, so take a little check to see how much space do you have underneath your knees, and do you feel the weight of your hips on your butt cheeks, or do you feel it on your flat sacrum? And then take a check to see what your toes are doing right now. My toes and my feet are pointed more towards the camera, where they should not be, but that's a lot of running. Running is great for getting blood flow, but it is not good for the fascial tissue around the joints. It gets them dehydrated and stiff. That's why we hurt when we're done. So take that little check. Now we're gonna come on up. Well, we're gonna come up slowly. All right. We're gonna put our rollers. I'm gonna start with doing a roll on the hips, and the dogs are gonna join me. So this is, you all have to move. So I'm on my sits bones right now. We're going to, come on Eves, go on. We're going to roll the roller back and get just below the hip bones. And we're going to do some gliding. Oh wow, that's just lovely. And we're gonna glide a little to the right. And gliding is when the roller is moving, and it's exploratory for you, for me, to see where we might have some stuck stress or some tender places. And it's preparatory too for the superficial layer of tissue. And I think I'll just start on this side because it is just a really lovely area. And now that we've glided, you can glide a little more and get a little more exploring to the side. And we're in the lower hip. Then I'm going to stop. The next step is we're going to shear. So shearing is when the roller's not moving and you are. So you can shear, shift your weight back and forth so the flesh is weighted into the tissue, into the roller. And I'm just moving the flesh back and forth, like shifting the bone over the flesh. And this is where all the magic happens. This is where the fascia is getting dehydrated or getting hydrated again. You can make little circles. You can actually here, because it's such a lovely spot, I can roll my body back and forth. Now, if you're feeling pop, you know, tight muscles, we don't land on the muscle. We want to nuzzle up against it. Go to the barrier is a great word that Sue uses all the time. Just go to the barrier, and we're rehydrating next to it. We're not trying to sound too many alarms in the brain for that muscle to contract. That's old school foam rolling that I used to teach for years. That's okay. Advances in science, we learn and we change, right? All right, I'm indirectly shearing where I'm moving the leg. The bone is essentially massaging the inside of the tissue, getting deeper. And then I'm going to press and weight, getting straighten the leg even. Nice focused breath. And then I'm going to do a little more exploring. So we go back to gliding. Now, as I get up to the upper hip, I can lay onto my elbow, makes it a little bit more comfortable, and you can come up much higher. So we're covering the entire area from the top of your pelvis all the way down. All of that is the glute. And we're just doing some exploring. So the roller's moving again. This is gliding. And then we're going to stop and we're going to shear. So we can shift again our weight. We can make little circles with the tissue. We can roll. This is a really good place. You're getting close to the TFL, IT band area. There's a lot more you can do for this if we were doing a whole lower body compression, lengthening sequence, which we're going to do this week at class. and then compress and wait, or I can do an indirect shear, just simply rolling the bone, rolling the leg up and down while I'm not moving up here. Nice focused breath. And we're going to glide to the other side. Now I like to stop in the middle and work right over my sacrum. So I'm pinning the flesh and I'm shearing my bone underneath the skin is essentially what it feels like. Shearing that tissue back and forth on the sacrum, the flat bone where your SI joints are. We'll get a little more specific to that in a minute. Then we're going to lean to the other side and start our glide again. So it's just up and down, finding tender places. I will refer to it in class, up and down, turn a little, up and down, turn a little, up and down, turn a little, so that you're coloring in the entire area that you're exploring and preparing all that superficial tissue. And then coming back and slowing down, and we're getting a little more specific with our shear. So I'm shifting my weight back and forth. The roller is not moving on the shear. You can make little circles. You can roll. I have a few little places in my glute med, glute min, deeper tissue. You're gonna feel like you're pressing deeper, but what's actually happening as you hydrate the superficial layers, I'm indirectly sharing, hydrate this more superficial layers, it gives you permission to go to the deeper layer. Now we're indirectly shearing, moving the leg, compress and wait, nice focused breath, and I'm going to come down to my forearm and I'm going to do the upper hip. So again, gliding, prepping the superficial tissue, exploring. So up and down, turn a little, up and down, turn a little. Ooh, there's some loveliness. And again, it's really hard as an athlete. Now we're shearing. It's really hard as an athlete if you were taught, which we were, and I taught it for a long time, myofascial releasing. Get in there and get it, dig it out, get on top of that knot. No, maybe not so much. That's not what we want to do. So nuzzle up against it. If you're popping over things, just come to the barrier, engage that fascia, and then do your shearing there. It's all about balance, right? Not too much, not too little. Compress and wait. And come back to the top. All right, I'm going to move down now to my hamstrings. So I'm going to turn a little bit this way. Well, I'll turn this way so you can see. So doing hamstrings, you're going to lay back. Just get a little closer because my head's not on the rocks. All right, so this one can feel really weird. I'm going to do one leg at a time. You're taking the leg out. Back up and see my foot. You're taking the leg out to the side, and what you're trying to do is twist the flesh. So you're not taking your leg and just gliding across the top. We don't glide here. We're doing what we would refer to as maybe more a passive shearing. So I'm going to actually hold the roller so that I can get a little more twist, but I'm going to make this active. I'm going to push my thigh down into the roller, and I'm going to take the leg out, and you'll see all the flesh is pulling to the inside. Then I'm going to turn my foot in, and I'm going to drag my heel and bring all the flesh to the outside. And we do not call it fat, it's flesh. We're intentionally focused on the fascial tissue. All right, had to preface that, clarify that. Turn your foot out. We're going back out to the side. Turn it in, back to the inside, back to the outside. Try to avoid keeping that leg stuck straight out and not be on top of the roller. We're trying to push into the back side of the roller and getting a good shearing or translation of the muscles are all running up and down. We're going across, and my dear sweet friend and mentor Eric Dalton would say we're separating the fascial bags, and what we're doing is hydrating the fascial tissue between the layers of those hamstrings. And if you think about it, this is the side where we sit and compress that tissue all the time. If you're sitting at a desk, sitting on the couch, just sitting is what we do. We compress that backside fascial tissue, the back of the thigh, hamstring, fascial tissue. And then if you're a runner, like I am, that we kind of shuffle, we're never really firing this end of the proximal end of our hamstring attachment. So it just stays compressed and gets dehydrated. Then we have pain, and then we think, get in there and dig it out or stretch it out. Really, we just need to shear and hydrate it out. So I'm going to move the roller down. Hopefully you were still following along. Now this is one you can do both legs at the same time. or you can just do one leg at a time. But again, this is active. Push your thigh down into the roller and pull the flesh to the inside. Turn the foot, pull the flesh to the outside. And you might even feel up the adductor, up the inside of the thigh when you come back in, right through here. When it gets to that end point of engaging that flesh, I can even feel it all the way up to my pubic bone, to my attachment of my adductors. Right, other side. And how many times do you have to do it? I'm spending a little more time on my hamstrings right now because that's an area that I've always struggled with. And we're getting ready to do some lengthening that's gonna help this area as well. But how many times, if you were just doing it on your own, I don't know, 3 to 5 would be sufficient, but they need to be good shears, really engage the flesh. So if in a perfect world, you could maybe recommend doing this with no clothes on in the privacy of your own home. Because skin to the roller is always the best. You can really engage the flesh, really engage the tissue. Now, I'm closer behind the knee, which is a very special spot. And if you're a runner, you're anybody, but if you're a runner and you've got knee challenges, IT issues, this is really good area. Not behind the knee, just above it, where all those hamstring, all the tendons are coming down and attaching below the knee. Your calf muscles are coming up and attaching above the knee. Great. Okay, now we're gonna do a little something different. We're going to take our roller, we're gonna pull it up underneath our hips, and make sure when you're pulling it up to your hips that it's not in your low back. We don't want it in our low back. If I were to put my hands on my hips, my fingers would be on my side of the roller, my hip bones. So I'm right on the flat part, the sacrum. So if I were to pull my legs up and pull my knees into my chest, the roller's not flying out. But if my legs are down, it is not tilting my pelvis forward. So right on the top of the roller. And we're gonna start by pulling the knees in, and we're just gonna do a little shearing of the SI joint, the sacroiliac joint. So I'm pinning that flesh and I'm just shearing the tissue back and forth. So right in the top. Then I'm gonna lean my legs, my weight to the left, to one side, and I'm just gonna move my knees in and out. So I'm getting a little direct shearing of the SI joint, the pelvis, where your sacrum and your ilium. Sorry, I'm getting distracted. There's a bunch of geese flying over in a V. It's so beautiful. Keep shearing. Now we're gonna take our leg and make little circles. If you have any popping, cracking, crunching, whatever that's a noise that shouldn't be there, just make your circles a little smaller. The whole intention is just an indirect shear where the bone on the inside is doing some magic, hydrating the joint deep. The bursa, the labrum, all those fancy words. Now we're gonna just march our way to the other side, shift our weight to the other hip. Let's get over where you can still see me. Shift my weight to the other hip and doing the same thing. Little movements of my knees, keeping my ribs, keep my core engaged. I forgot to tell you that. That's just an always thing. Nice, slow belly breaths. You're making big circles with that knee. Then we're coming back to the center. Now we're gonna do a little bit of a tuck and a tilt challenge. It helps me release my low back, my psoas, that fancy word. And if you'll take your hands and put them on your front of your thighs, and I'm going to engage my core. So if you go shh, little exhale with your sound, shh, that'll really get the transverse abdominis, your core, true core, engaged. So I'm going to be active with my knees. I'm pushing my knees into my hands and keeping it there. And I'm going to slowly try to tuck and tilt my pelvis. So it's a very slight movement where I'm tilting, pulling my pelvis back, and tucking and tilting my pelvis. Let me rephrase that. Tucking, pulling my pelvis back, and tilting where I'm putting the back side on top of the roller. So again, we're going to push our knees into our hands and tuck and tilt. So inhale and tuck and tilt. So it's a very, very small movement. And if you find yourself squeezing your glutes, squeezing your butt cheeks to do this, or really using your abs to do it, you might not be doing it right, but that's why we practice, right? All right, keeping the right side engaged. So I'm going to continue to fire and flex my knee into my hand, okay? I'm going to inhale, and on the exhale, I'm going to lower the left knee down. So I'm keeping the psoas muscle, my hip flexors fired over here, and moving the other side. Now let's switch it up. I want you to fire this knee, this thigh into this hand, contract it, inhale, and lower slowly this leg down. Keep this active. Don't let your ribs, low ribs, come too far off the ground. Keep your core engaged. Good, we're gonna do that one more time. Fire this side, inhale, and lower it down, and back up, and switch it again. Knee flexion is going into this hand, lower in the other, and back down. All right, let's get a little length in here. I'm going to take my strap. If you have a TheraBand, great, you can grab it. If not, you don't even have to use a band at all. It just seems to help a little bit. So we're gonna get a little bit of length and a little shearing on the top of our quad and get a little fluid moving two directionally. So what I mean by that is we're going to take the right leg and we're gonna pull it into our chest, and the other leg we are going to bring down to the ground. You're gonna tuck your pelvis under and make sure that you start with your big toe, lower your toes down, lower your heel down so you're very even with your foot that's on the ground. And I'm gonna take an inhale, and on the exhale, I'm gonna pull my knee into my chest and push the left knee, the one that's on the ground, out. So this is very active. I am trying not to push through my foot. I'm trying to lengthen that way, going your knee away from you. Inhale and let go. All right, so we're gonna inhale again, and on the exhale, we're pulling one knee in, and at the same time, we're lengthening and pushing, intentionally pushing that knee out. You'll feel this beautiful opening in the front side. Good, come back. Let's do that one more time. Inhale, and on the exhale, we're gonna pull this knee in and lengthen. So the pelvis is tilting, but this leg is driving that knee away from you. You'll feel this nice long, that just released. That felt so good. All right, bring it back and let's switch it up. So left knee, we're gonna bring it in towards the chest. The right foot, you're gonna put the toes down, drop the heel, make sure it's centered, even weight on your foot. Inhale, and on the exhale, you're gonna pull the knee into the chest. At the same time, you're pushing this knee away from you. Try not to push through the foot to do it. You're pushing the femur or the knee away from you. Inhale again, relax that, and exhale and pull the knee in and lengthen at the same time. So this is two directions. One pelvis is going this way, knees going that way. You're getting a good lengthening in the front. One more time. Inhale, and on the exhale, lengthen. Very small movement, but very, very powerful movement. Good job. Now we're gonna get our strap. What do I do with it? Here we go. We're going to take your strap. If you have, the TheraBand, whatever, that's fine too. We're going to take this leg up into the air. I'm gonna grab it. Actually, we're not doing that. We're gonna grab it with one hand. Make this leg light on the ground. Engage your core. And we're going to bring the leg up. Don't let the knee move. Now we're going to, with our breath, both two directions. We're gonna flex the foot and tip the pelvis back or onto the top of the roller. So the pelvis is going to go down or out and down while the heel is going up. So inhale and exhale and tilt the pelvis down while you lengthen the heel up. So it's a two-directional shearing or lengthening here. Inhale again and exhale and lengthen. So the pelvis is tilting away or heavy on the back side of the roller. You're gonna feel a pull down and a lengthen up. Good. Relax one more time. Inhale, exhale, and heel up. Foot flexes and the pelvis is down or heavy on the back side. Good job. Let that come back down. We'll switch sides. Oh, what is that? That's so neat how that feels. It feels much lighter. All right. Legs going up. grab. So the band just makes this easier to do, so you can relax the muscles of your legs and keep the knee locked out. But again, you don't have to do this. You don't have to have a band. So we're gonna hold the foot, come up to the point where the knee doesn't bend. Inhale, and on the exhale, we're gonna flex the foot and tilt the pelvis on top of the roller. So 2 directions, it's pulling at the same time. And relax, and then inhale. On the exhale, flex the foot, heel goes up and pelvis goes down. Going 2 directions, like someone's pulling from the heel and the pelvis tilting down to the ground. One more time, inhale. Exhale, flex the foot, heel goes up, pelvis tilts down. Great, take that back down. All right, you can bring your knees back in, do a little shear. And that will take the roller away. And I would like to finish with my calves before we reassess to see what changes we made. Now, when you're doing the calves, I like to break it into 2, if not 3 sections. We don't do big long rolls or big long glides. We're going to start in the middle of the calves. Or I'm going to start in the middle of the calves. You can start wherever you want. But I'm going to start in the middle of the calves. Okay, you can see me. And we're simply just gliding up and down, turn a little. Up and down, turn a little. You can go both directions, both feet going the same way. And we're exploring. So little movements up and down, these just feel lovely. All right, up and down, turn a little. We did some exploring. I found some great places. Now we're going to stop and we're going to shear. So I'm going to take my feet out and take my feet in. So we're going to try to push to the back side of the roller, the foot side of the roller, not on top of the roller. So pushing down. So my knees are kind of up, my heels are down towards the ground, making it active, pushing in. You see the muscle tissue flare out. Now we're trying to flare the muscle tissue to the outside, flare the tissue to the inside. So we're getting this shearing pull. And if you're doing it right, the roller's creeping up to the back of your knee. And if you got some really tender, lovely places on this lateral gastroc, which I normally don't, but I do today. If you're popping over it, we can just do little rolls because we're not trying to pin it, right? We're not trying to do my fascial release stuff. I'm gonna cross a leg over and add a little indirect shear so I can just move my foot around. And you can feel that translation. I'm pinning the fascial tissue and then I'm translating the muscle underneath it, which is getting good hydration. So it's indirect shear. And then compress and weight. Good. We go to the other side. I had another little lovely place there. Indirect shear, moving that foot around. And the smaller you can get with your actions, the more magical the outcome will be for you. We tend to go too fast. It's just like in massage. If you think you're going slow, go slower, right? So now we're going to move it down to the lower leg and we're going to do some exploring. So up and down, turn a little, up and down, turn a little, up and down, turn a little. Loveliness is all in there. But you know, post long run, it should be. If it wasn't, there'd be something wrong, right? But this is how we don't get repetitive stress injuries, and we don't get a lot of accumulated stuck stress in our calves that then makes us have plantar issues. And now we're going to shear. So just in and out, pull that tissue. A lot of the foot challenges that people experience really comes from the calves, which then affects the glutes, and it's a big mess up the back line. My favorite saying is, it is where it isn't. So even though you think you have challenges in a place, you do, but it's not caused by that place. All right, so I'm shearing back and forth, and I'm gonna get a little slower with my movement because it's getting a little tender. And again, try to fight the urge to to get right on top of a mass, a painful area that is not going to benefit you long term. If you have a cut, you don't pour alcohol in it. We're not trying to cause more pain to a painful area. We're going up against it. The indirect for direct approach. Good. And then I'm going to take a deep focused breath. And and relax. Now we're gonna rinse our lower leg. So I'm gonna do one at a time to be more effective. I'm going up the inside and down the back. So let me show you that again. Just up the inside, one direction, bring it back down. Up the inside, bring it back down. So what we're doing, we did all that good shearing and we got all this fluid hydration going. Now we're trying to move it globally. Move it through the body. So up the inside, down the back, 3 to 4 times is good. And I'm finding that to be a little bit tender naturally because of tibialis posterior. But this is just a recovery compression, get a little bit juices flowing so that I don't hurt in the morning. And magically, I won't after doing this. All right, now let's just take a quick assessment, see what kind of changes we made, which is always fun to do. Like I feel like a different person right now. My rib weight is heavy where it should be. My low back has a normal curve. It should be, if I were to put my belly button, finger in my belly button, that low back curve should just be a nice little curve. But earlier, before we started from running, my back was actually curving from really higher in my ribs all the way down. It was so grabby, I couldn't even relax it. And then the weight and space behind my knees is the same. My feet are going the direction I want. They're not pointing so hard down. We just made all kinds of magic happen. So if you'd like to be a magician too and make your body feel better, you need to get a roller, a soft roller. You can get them online at meltmethod.com. If you're here locally in E-Town, you can get them from the office at Karma Yoga Studio or In Touch. It's now in the same location, so just different entrances. And if you don't have a the little bag of balls, there's a couple soft ones in there, different sizes, and a couple hard ones. That would be great to do a foot treatment right now as well. We did one before we ran, but it would be awesome to do another one. So thanks for joining me. Hope that was helpful. And if you ran or exercised today, you need to do that. Have a great day.